let's get started. We're going to have a look at managing diabetes to reduce kidney disease, actually, which could be quite close to all our hearts. Thank you very much. Let's give a warm welcome to Tim Ringrose, please. Thank you.
Thank you very much. Thanks, Roy. Well, great to be here this morning. My name's Tim Ringrose. I'm a kidney doctor from Oxford, and I'm CEO of Cognitant Group. And I'm going to talk today about diabetes type 2, kidneys, and what we can do to reduce the numbers of patients that encounter significant kidney disease that might even require dialysis or a transplant in the future. I'm here on behalf of Cognitant, in partnership with Bayer and an ICS, Suffolk and North East Essex. First, I'm going to talk to you first about kidney disease, but I'm going to come on to My Kidney Assistant, which is a program that we've built with those partners, the ICS in Suffolk and North East Essex and Bayer. But first of all, I'd like to talk about kidneys. Now, our kidneys are probably one of the most underappreciated organs that we have. When they're working fine, they're probably, if anything, a little bit of an inconvenience. Roy's just had to nip off to the loo because our kidneys are constantly filtering our blood and producing urine.
Do you mind?
I'm glad you're back.
Well, Carol Sikora was there as well, with two old geezers together.
You weren't very long, that's a good sign.
That is true. The flow is so important, isn't it? Why are we having this conversation?
I think you should sit down, Roy, yeah. The problems are when our kidneys are not working so well, we might not have very many symptoms at the start, but they can produce multiple symptoms and have a devastating impact on the length and quality of our lives. Now, I'm sure you don't know this, but 1 in 10 of the population have some degree of impairment of their kidneys. A huge number of people. So there's a lot of people here who have impairment of their kidneys. About half of these have got minor disease, and probably 1 million of those don't even know that because there are very few symptoms at the early stages. But the other half have moderate or severe kidney disease. This can cause lots and lots of problems. The NHS currently spends over £6 billion looking after patients with kidney disease. If you have moderate or severe kidney disease, it's not only bad for your health, but you use a lot of NHS services. If you've got severe kidney disease, you have a 75% chance of needing to be admitted in any particular year for one thing or another. If untreated, kidney disease will progress in most cases. The worst case in terms of your kidneys is that you reach what's called end-stage renal disease, where you either need a transplant or start dialysis. There are about 30,000 patients in the UK who need dialysis. That costs about £34,000 per patient per year, on top of all the other costs of your healthcare. But I think the most important thing, dialysis is pretty miserable. If you know anyone who has dialysis, it involves being plugged into a machine 3 times a week for a few hours. Some patients have home hemodialysis. You have to be trained on how to do that. It's not fun. So take it from me, you want to avoid dialysis if you possibly can. Now, there are lots of reasons why chronic kidney disease is getting more common. There are currently about 30,000 patients a year having dialysis right now, but kidney research predicts that if we don't do anything about this, within 10 years, there'll be more than 140,000 patients needing dialysis. And the reason that we're getting more patients suffering kidney disease is because we've got an aging population, we have higher incidence of cardiovascular disease, such as hypertension, and as you probably know, we've got a lot more people with type 2 diabetes. And in fact, type 2 diabetes is the most common cause of chronic kidney disease in this country and most countries. If you have chronic kidney disease, you're at a much higher risk of having cardiovascular disease. So there's a very nasty, vicious circle between cardiovascular disease and chronic kidney disease. If you have cardiovascular disease, you're more likely to get kidney disease. If you've got kidney disease, you're more likely to have a stroke, something like 20 times. All sounds very grim, doesn't it? I'm going to cheer you up, because there is a solution. Now, I've mentioned that diabetes is the most common cause of kidney disease, and you're probably thinking, well, why does diabetes cause kidney disease? Well, in common with most other organs, in diabetes, whether it's type 1 or type 2, but of course many more people have type 2 diabetes, you have changes to your microcirculation, the tiny blood vessels that are perfusing all our organs. And in fact, the kidney has about 20 kilometers worth of tiny capillaries. If these are affected by diabetes, you get a disruption in the flow, and this actually causes an increase in pressure of those little filtering units in the kidneys, the glomeruli. And the earliest sign of that is when you get small traces of protein in your urine, which can be detected with a simple dipstick test. So if we take a population of patients with type 2 diabetes, close to 50% of those patients are at risk of getting kidney disease of one form or another. It may not be serious enough to require dialysis, but it may well be quite severe over time, left untreated. But here's the good news, is you can do things to prevent kidney damage from diabetes. If you control your blood sugars well, if you control your blood pressure well, if you lower your cholesterol, and if you stop smoking, if you smoke, and take some good lifestyle decisions around reducing weight, a healthy diet, reducing salt and exercising, you can dramatically reduce the chances that your kidneys will develop significant kidney disease. And there are also some really good drugs that have come out in the last few years that are recommended by NICE, which will help to do these things, to lower your blood pressure and reduce the impact of diabetes on your kidneys. But here's another problem, is that a lot of patients with diabetes don't understand what they can do to reduce their risk of damage to their kidneys. And if you look at the general population, 40 to 60% of the population struggle to understand currently available health information. And it's been shown that if you have chronic kidney disease and you have low health literacy, you're likely to have the worst outcomes. You're more likely to need to go into hospital, you're more likely to have poorly controlled diabetes and blood pressure, and you're more likely to have need admission to hospital. So communicating to patients to help people understand about their diabetes and understand how to manage it and how to reduce the risk of chronic kidney disease is vitally important. So this is why Bayer, Cognitant, and the ICS got together to co-design with patients and clinicians a service that was going to help patients with diabetes understand what they can do to reduce their risk of kidney disease. And to start with, it's very important to explain why are the kidneys affected, what do the kidneys do, and what can you do about it. This is, of course, good for patients, but it's also very important to do this so that we can reduce the load on our overstretched NHS resources. For every patient that we can stop needing dialysis, of course, we save the money on dialysis, but there are a whole load of other NHS costs that can be saved if we can protect everyone's kidneys. So what we've done is we've built a program called My Kidney Assistant. It's a digital program. It provides trusted health information in multiple formats to help people understand their kidneys, how diabetes affects them, and what they can do. It also allows people to track their clinical data, such as their blood pressure, their blood sugars, to monitor how they're doing, to set goals, and to share the information with their family and friends or their GP. The information that's covered in My Kidney Assistant covers a whole range of topics, from basic explanations about how the kidneys work, to what sort of tests they should be expecting to have done, what the results of those tests mean, what medicines they might be prescribed, why they be prescribed those, why it's important to keep taking them, and what lifestyle choices they can make to improve their health. Now, I've mentioned about health literacy, so it's very important to produce information that's easy for people of all ages and abilities to understand. So we've really focused on producing visual, interactive information. Our aim is to make it so easy that a 9-year-old can really easily understand what's being said, and more importantly, can remember it. As I've mentioned, there are tools to help patients set goals, to upload clinical data, and to track things like their blood pressure or weight. But the best way to appreciate this is if I show you a video so you can see what it looks like for yourself. So here we go. There's no sound, by the way, so don't worry, you're not missing anything. So you can see how we've used visuals to show where the kidneys are. Most people have two. The formats are quite simplified, so this will work on pretty much any screen size, whether it's a smartphone, an iPad, or a computer. It's web-based, but there's also an option to download. We explain about the vascular changes in diabetes. And we have a microscopic view. This is a glomerulus. This is one of those million little filtering units in the kidneys that are working all the time. We explain about the different stages of kidney failure and what that means for every person. And someone can track their physical scores or their anxiety scores and make a plan for how they're going to manage their lifestyle, whether that's stopping smoking or exercising more. So let's move on. So what are we going to do about evaluating this? Well, we're now piloting this program in Suffolk and North East Essex ICS. At this stage, what we're looking to see is patient feedback. We're looking to see how many patients use it, how they use it, how often they use it, what time they spend, what goals they set, what data they upload. Of course, we're going to protect their personal data. And we're also going to be looking at the impact on the clinical care pathway. How does this affect the GPs in terms of managing diabetes? What we often hear from GPs is that there isn't enough time to educate patients. So how does this help GPs to provide information and help patients to help themselves? And then we're adding in more features. So our next program is to add in an integration with remote testing. So as I mentioned, the earliest sign of kidney disease in diabetes is protein in the urine. There are remote testing services out there, such as Healthy.io, and we're integrating with services like that so that when a patient does a test like that, they can see exactly what that means and what they need to do next. So we're now making it available across the NHS, and we're talking to a number of ICSs. So if you'd like to know more about it, do come and talk to myself or Alex. We'd be delighted to explain how this can be made available in your particular patch. Thank you very much.
Oh, well done. Thank you.
All right.
Right, I expect we'll have a few questions. Have we got any questions? While you're thinking about it, let me ask some questions. What's the sort of financial model of this? Is it, does an ICS buy it and then give it to the patients? Is it an outright sale? Is it a license? What's your business model?
Yeah, it's provided under license. We charge around £2 per patient who's in the target group per year. So it's a relatively low cost. If you think about it, the cost of printing something out and sending it in the post is actually more than that these days.
Absolutely, yeah. And I suppose you could link it to the NHS app. I keep on about the NHS app because I know the NHS has spent a fortune on it, and now we're supposed to be linking things up, and we have the great czar of linking things to the NHS app, who's one Joe Henderson, who runs a fantastic hospital in Milton Keynes, and he's doing this in his spare time, although I'm not allowed to say that. But I mean, this is the kind of thing you could link to the NHS app, isn't it?
I'm glad you mentioned that because it's integrated with NHS login, so patients can use the same credentials that they use to log into the NHS app to log into this service.
Yeah.
And we are in talks with Joe Harrison and the team.
Good
about
old Joe, right?
Yeah.
There's a lot of people queuing up to talk to him, I think. Yeah. And is there a benefit in connecting this into the GP record? Is there anything that a GP wants to know about this? I mean, I imagine there might be.
Yes, well, integration with clinical systems is important, but it's a minefield, really, of different systems at the moment.
Well, you've got EMIS and System 1 and I suppose community services as well. I mean, this is the kind of thing that maybe a community nurse might be interested in looking at.
Exactly. So we've started from the premise of let's let the patient own their data, and then they control who they share it with.
Yeah.
But you're right, there are ways to integrate it with the system. And coming back to the NHS app, one of the things the NHS app will allow us to do is to integrate it with the care record through the app.
Yes. And have you got any sort of patient use experience of it? Have you trialled it with real people?
It's actually just went live in the last month. So we have trialled it. We've done lots of focus groups and lots of co-creation with patients.
Yeah.
Patients really like the accessible content, and generally know very little about diabetes, so this has really helped them.
Yeah. And does the fact that type 2 diabetes, I mean, it's pretty agnostic on age, but quite a lot of type 2 diabetes comes to people in their later years. How have you got any feelings about, where everybody who's old? I mean, I'm 77, and everybody that's old is supposed to be useless with IT. And if anybody tells me I'm useless with IT, I just hit them on the head with my iPad. But there is some, issue about older people and IT. Is that a factor? I mean, I don't think it is, but
yeah. Well, you're right. I mean, diabetes affects people of all ages, so there are some quite young people who have type 2 diabetes. I know quite a few, but there are a lot of older people who suffer from it. Yeah. But it's wrong to make judgments about who's digitally capable and who isn't, because I think it's important to ask questions. If you do online banking or do online shopping, you'll find this a piece of cake to use. Yeah. But I think there are people who either don't want to or struggle with digital technology. Yeah. And I think the way to look at that really is that if we can use digital tools to help the 80-90% of people who want to use digital tools, it frees up the healthcare system, and GPs in particular, to spend more time with the people that need that face-to-face.
I think it does. And I mean, we had a very interesting presentation this morning, first thing, on virtual wards, where grannies get parked with an iPad and keep your fingers crossed. But I mean, it's coming to a patient near you, isn't it? We can't avoid it.
Yeah, exactly. Yeah.
It's really... And are you focusing on type 2 diabetes for reasons I understand? Is there any benefit for type 1 diabetics?
Well, there's a lot of similarities in terms of how diabetes affects the kidney, but of course the management of type 1 diabetes is often quite different. Generally they're on insulin. A few patients with type 2 have insulin. So there is the opportunity to develop this and to look after more patients. And in fact, I think there's also a need for services like this for patients with other causes of kidney problems, such as genetic problems like polycystic kidney disease or high blood pressure, or the inflammatory conditions.
And is there a way, I might have missed it in your presentation, is there a way for the patient to kind of track themselves through this? So if for example, one of the goals was weight loss, for example, is there a sort of graphic on weight loss if you put your...
Yeah, so exactly. So you can either manually put in your data, or you can link up to a service and integrate that data. Yeah. So our first integration, as I mentioned, is with the testing of the urine, so that you can look at your results and see what that means. Yeah.
And is there any access for a relative? Perhaps a younger niece or a daughter might look after their mum with this?
Again, it's very much in the control of the patient. So if the patient wants to share their information, they can share that information. Yeah. They can send an export out to whoever they like.
Yeah. Yeah. I think it's very interesting. Anybody got any thoughts or questions that you want to raise? No? Well, I think we're done. I think we can't wait to have type 2 diabetes, I think. Oh, here we are. Right, I'll come round the corner. Here we are. Right, I'll hold it for you. You're far away. Just tell us who you are and your PIN number. Yes.
I do have a question just regarding the personalization there. Just want to understand that regarding the personalization, it's more of from the education purpose, or it's more from the kind of manage my kind of symptom purpose. Just want to understand that, because I just think how my education can be personalized.
Yeah, that's a really great question, thanks. We do personalize the information that a patient sees. There are a number of ways you can do that. So when you first engage with My Kidney Assistant, you'll be asked a few questions, and based on your answer to those questions, it'll personalize the information that you see. When we integrate with the clinical records, that gives us the opportunity to automate some of that. So rather than asking you these questions, we know a little bit about you. We know that you're on a particular drug for your diabetes or a particular drug for your hypertension, and then we can list that there for you. And then as you use the service, we can personalize it based on the information that you have there. So that, for instance, if you put your weight and height, we can work out your BMI and tell you if your weight's about right or if you're a bit overweight, and personalize it that way.
Thank you. And I think your stand is just around the corner here.
Just around the corner. Can't miss it.
I'm out of time, but as it's you, I'll risk the wrath of the conference organisers. Just very briefly, if you would.
Okay. So Dana Carter from Salesforce. Just picking up on the integration piece, it sounded like the GP and Community Care Connect is sort of still TBD, but are you integrating, sharing the data with the acute care providers within the ICS?
Thank you.
Not yet, is the honest answer. So we're prioritising integration with the primary care systems. But one of the great things about the ICSs, the ICSs may not be doing everything right, but one of the things they are doing right is integrating primary and secondary care services around the patient. So it is very important to link up with the acute care record as well.
And you are right, because it's the money thing as well, isn't it? You know, ICBs are very interested in money, and if you can keep people out of hospitals,
Yep.
that's where the money's saved. Good. I'm going to have to leave it there, I'm afraid. But I think your stand is just around the corner, isn't it? Yeah. And they're giving away some rather nice pens, so it's worth a visit. Okay. Round of applause. Thank you very much.